Starting today, if you have Cigna health insurance and you use UNC Health Systems, you'll have to find a new provider or risk paying much more money. After months of negotiations, the two sides could not come to an agreement before Sunday's deadline. WR's Sean Gallagher joins us live now. And Sean, in terms of negotiations, where do the two sides stand right now?
Oh, this morning, they both tell me that the negotiations aren't dead despite the deadline having passed. So starting today, despite those contract negotiations, some 65,000 people who use UNC Health Systems and have Cigna will have to make a very tough decision about the future of their health care. Now, the deadline has passed. Cigna members who use UNC Health will need to find a new provider in network or pay a much higher price now that UNC Health will be considered out of network or just pay out of pocket entirely. It's putting people like Becky Pizzoni in a bind. She's a cancer survivor, and while the outlook for her future is good, she's concerned if it returns, she'll have to find a whole new care team or pony up to keep her current doctors.
It cost me at least $4,000 more a year. I'm pretty concerned about that. I could use that money for something else if I stay. Otherwise, it's just going to be the stress of finding somebody and getting established and transferring your records. And meanwhile, could somebody please renew my prescriptions?
Now, we have received statements from both Cigna and UNC Health today. UNC Health telling me it remains committed to continuing negotiations, and they are hopeful Cigna will work with them to reach an agreement that puts patients first. And Cigna says, our goal is to keep UNC Health in network, and we have offered to extend our current contract. We remain engaged in discussions with a goal of reaching a fair agreement for our customers and their families. Now, Cigna members who are using UNC Health could be eligible for continuity of care for a limited amount of time, but it's really only people who are pregnant, currently hospitalized, or receiving an active treatment before today. And then even still, those people need to contact Cigna themselves to see if they're eligible in the first place. They can do that by dialing the number on the back of their card. In Raleigh, Sean Gallagher, WRAL News.